Welcome everyone to the Mom Empowerment Podcast. My name is Iethar.
And I'm Ramatan.
And thank you for joining us again. Today we're going to review a new topic, but last time we talked about mom guilt and what that looks like for us. And we dived into some of the tips and tricks of how to navigate mom guilt. And so
today we're talking about something that many moms go through but don't always talk about: how motherhood changes us. It changes our identity, our priorities, and our sense of self. So to start, I want to introduce a topic that was new to me, like a term that was new to me in psychology, which is called matrescence. It's basically like adolescence, but with motherhood. And it's just as significant and important as adolescence. So it's the physical, emotional, and psychological transition into motherhood. According to Dr. Alexandra Sachs, who is a renowned psychiatrist and co-author of the book What No One Tells You, A Guide to Your Emotions from Pregnancy to Motherhood, this identity shift is recognized as a psychological transformation. And it's as radical as adolescence, and it actually changes with every child that you have. So that's why sometimes we feel like we have different experiences with each child, because our identity is actually shifting with each child that we have. So no one experience of motherhood is the same as the next, kind of thing. So when did you feel like, when you became a mother, what's one time that you really felt that motherhood changed you? Or maybe a moment where you realized like you're evolving into someone different than you thought you would be as a mother?
I think with like the two kids that I have, with my first pregnancy, I felt that my priorities really shifted. Things that I was paying attention to no longer mattered the same way. And I thought they were bigger deals. And I started paying attention to that shift when I had other people that were not in the same season of life, thinking about like things that they're going through, like their own milestones. So like, for example, somebody that's getting married or something like that, where they're focusing on event planning, or when we're redecorating a house, like what does that look like? For me, those things were important before becoming a mom. And then when I shifted, it's like I lost a bit of that interest in them. And I don't know if it's, and like I still like it. I like it, but I feel like I ended up being a bit more dismissive of other people's experience, because I'm like, my priorities shifted, like I'm more paying attention. So, and that was not the intent, but I think that's where I was like, oh, like now I can understand why some things feel more important for mom friends that were moms that when I wasn't. So I get it a bit more now. I think that's the first shift. But then to your other point, when you were saying that no like experience of motherhood is the same, because I felt like there was a different shift in my second pregnancy too, where my priorities were also different. It was still aligned with that, but I felt like I had a different need of like reframing things, because I felt more on edge. And I don't know if it's because I was managing two now, but my needs were different. Like something else was shifted. I don't know what it was. Like we're going to dive into that topic a bit more today, but I felt like a shift. What about for yourself?
I feel like for me, I found motherhood very different in the 3 times that I experienced it, and still experiencing it. I feel like obviously like after the first one, you kind of know what to expect. So it's a lot less pressure on you. But for me, with the first one, I was trying to do everything right. And like the societal pressures and like what's expected of women and the mom, and doing it all. I was trying to do everything right, and I did it for a while. And then with the second one, I started letting go of a little bit of that pressure and just listening to my own intuition. And then with the third one, it's all intuition, honestly. It's just intuition. I'm not listening to anybody's opinions, or I'm not caring about society. I'm really like, this is the third one. So I'm listening to me, myself, and I in raising this child, and listening to my needs, listening to her needs. And I think like, yes, I did lose a part of my old self, and my identity shifted, all that, but I'm growing in different ways. But there is another author, Ramatan and Iethar. She is actually a psychologist and head of the maternal psychology lab at Columbia University. And she's one of the first ones who actually started using the term matrescence in psychology. And she says that it doesn't end after the early months of caring for a baby. It evolves with each child and carries on throughout the mother's life with the children. So it's actually an ongoing process, you know. And she makes the point to say that we study adolescents so much and we give so much support to adolescents when they're going through these things, because there's so much confusion and so they need so much support and help. And we don't necessarily do that with mothers, but it's a very big shift as well that needs attention, that needs support, that needs people to understand it, workplaces to understand it, to better support them.
That's interesting because we often talk about like the first trimester, second trimester, third trimester, but nobody talks about the fourth trimester being the postpartum.
Yeah.
And even like, you know, with first, second, and third, the attention that's there is not necessarily even on the mom. It's like, is the baby growing? Is the baby okay? And then when we give birth, you know, we have our postpartum appointment like 6 weeks after, and then it's like you have that appointment and then done. Your kid still gets checkups. You still have to go do, at least here in Canada, I don't know how it works in other parts of the world, but you still get like these checkups with your baby. So they're still checking in to make sure the baby's developing, but there's not really that many doctors that ask, how are you as a mom, you know? And then even the 6-week question of like, you know, how's it going? What do you expect her to say, especially as a first-time mom? You know, some of them might feel like they can really share, like depending on the approach of the doctor.
Yeah.
But it's like, you know, to our topic last time, you're going to feel very guilty, or you might feel a lot of shame if you were to come and say, it's been really hard. I'm struggling. Not all of them talk about that. And like the question that, like, have you been getting sleep? Of course I haven't been getting sleep.
Yeah.
And even when they ask questions like, you know, do you have community? Like, even if you have community, even if you have people around, like, how do you talk about that? Because that's the thing. We don't necessarily spend a lot of time talking about how the motherhood transforms us, and like the support is not necessarily what each person needs. And it's not like a cookie cutter, like mold or whatever. But that's the thing. Like, to your point, we talk a lot about adolescence, but interesting. This, you know, I've never even heard the term mattresses.
Yeah, me too.
You know,
it's eye-opening, actually. Your point that how we often feel guilty for not being ourselves anymore. I think we go through that, but if you're going through this right now, honestly, there's light at the end of the tunnel. Just keep like listening to your intuition. Just let it happen, honestly. Don't fight it because you're going to end up a better mom and a better person if you continue in the process.
Even with what you're saying about these changes, one of the things that I wanted to talk about is how biologically our brain actually changes, you know, and it starts from motherhood. So we talk about like the gray matter and how it changes within our brain. Physically, our brain is changing. I know sometimes when we say, oh, I have mom brain, I have brain fog, it's just actually our brain biologically changing so that it focuses on things that are more primal or important.
Exactly.
So, you know, like when I was saying the example of like my perspective changed where I don't really care now about decorating my house a certain way. It's because my focus has been, did I book an appointment for my kids? Are they safe? Am I following the recent trend of like how to do this with my kid? Or am I being a good mom? Like, the shift is focusing on that. So our brain is actually making room for things that are more important. So that's why we forget. Like right now, I couldn't find where my AirPods are.
Yeah.
Like I have no idea where my case is. I'm going to have to look. I have to put the tracker thing and look for it. And that's the thing. It's because it's not important. It's insignificant. But in the moment, I'm going to panic and I'm going to be like, this is so important. I don't know where it is. What's wrong with my brain? Well, your brain is actually thinking about things that are much more important.
Yeah. The invisible load of motherhood that we talk about so much.
Exactly. Exactly. And it's a load that I don't think we attribute a lot of attention to.
Exactly. Like actually many studies have been done about this, but like as partners, like men and women have very different loads, even though they could be doing the exact same things. They have very different mental loads. And studies have shown time and time again that moms carry significantly more of the household mental labor, and even in dual income homes. So this is not something new, and it's not something that's necessarily going to change, because this is our biology. Like, this is not something that's easy to change. It's just kind of something we have to learn to adapt to, and to set boundaries and not let it take over our lives.
Mm-hmm. I think this ties also to what we addressed in our last episode about how, you know, moms and fathers might experience parenthood differently.
Yeah.
And like even that invisible load might be different because, and that's what could challenge a couple, like,
Yeah.
and test, because then you kind of find yourself keeping count of like, I did this and
Yeah.
I did this and you didn't even see it. And then,
Yeah,
and then that's
that's
how it
true.
kind of spirals. And then it creates that sense of resent. And
Yeah.
then we're like, okay, but do I have to carry all of that? And that's the part where for myself, I know we're going to talk about like more tips and tricks later, but for myself, one of the things I catch myself doing is this invisible load. There's the one that is the primal part, like the one that comes with those maternal instincts. But then there's like a load that I'm actually adding to myself. So for example, needing to clean up right after my kids played.
Yeah.
And then they're going to take out everything again. And it looks like I just picked up for no reason.
Yeah.
I added that load.
Yeah.
So it's kind of looking at, and sometimes it might bring me like comfort in the moment of like, I just need to pick it up. And maybe it's a sense of control. Maybe I need, maybe because I feel like I lost a sense of self and this is what I can control. And that's part of the questions we'll have for reflection, you know, at a later on.
Yeah.
But it's taking that time to really look at what belongs to me, what belongs to our couple, what belongs to our role as parents. Because if not, it's very easy to spiral into a negative thought process.
Yeah, of course. Sometimes it gets too much.
So one of the other things that we want to kind of touch on when it comes to how motherhood transforms us is grieving our past self, and then how to accept this new sense of self, you know, how motherhood changes us. And looking at why it's still okay to kind of grieve who we were before, and how to make room for who we are now and who we want to be. Like we still, like even as moms, we still have hopes and aspirations and dreams and whatnot. It doesn't get lost because we become moms. It's how to reconnect with that new part, but it could be a long process to get to.
Yeah.
When we look at the grief part, it actually resembles the same thing of the 5 stages of grief. You know, so we have denial, anger, bargaining, depression, and acceptance. And so when we look at the first stage, being denial, we kind of start that even before we become moms, because we start denying, like, you know, when we look at, for example, especially as first time moms, when we look at other moms, we might say, oh, like, I don't think I'm going to react that way. You know, like when I'm going to be a mom, it's going to be different. And I think one of the quotes that hit me hard was, the best parents are the ones that have no kids.
Yeah, of course.
And I remember having these conversations, and I'm like, oh, when I, like, no. Like, it really, that the denial, that hit me hard a lot. And so we underestimate the impact that motherhood or becoming a parent has on our personal freedom, our careers, our relationships. Like, we don't realize how much it's going to impact because we think we would know.
Yeah.
You know, like even the exhaustion, for example, we don't realize how much it could impact us. And so that's where, like, the sense of self starts to change, but we're still in denial. Like, you know, if I do this better, and actually I'm going to go back after to the ifs, but we deny how there could be an emotional and physical toll on us, on our relationships. And so some of the studies actually show that, you know, new moms really don't anticipate how their lifestyles are going to change. And even when you prepare for it, it's not enough.
Yeah.
Like from personal experience, one of the, you know, because I like prevention, like I want to prevent, you know, and because of my field of work, one of the things that I did was I set up meetings with a therapist before giving birth, because I was like, you know, postpartum depression is common, and, you know, I just want to make sure that I see the signs if they happen. And so I set up meetings before giving birth, and I was like, oh, I'm being proactive. And thankfully, you know, I didn't go through postpartum depression, and I know it's very real for those that go through it. It's a very challenging experience and could be very isolating.
Yeah.
I don't know if doing those sessions really prevented anything, but it didn't stop me from being shocked.
Yeah,
of like,
of course.
Like it
It's true.
still hit me hard, How did you experience this stage?
Yeah, I mean, the same thing as you, like you don't know what you to expect until it happens, until
Mm-hmm.
you're actually a mom and you have a baby to take care of. And I think even in the first stages, like in the first few months, you kind of, I felt like a robot. I was just doing everything that needed to be done, but I was not like, it wasn't hitting me until later on, I guess. I think that's the case for a lot of people.
Yeah.
In the beginning, you're in survival mode. You're trying
yeah.
to survive. You're trying to survive, and you're trying not to mess up this baby that God gave you. So you're making sure that the baby survives as well. And then later on is when you really start to like think about stuff, and really it starts to settle in, and you start to process everything that happened.
Yeah. As a mom of 3, do you feel like you experienced denial in every child? Or did it look
No,
different?
I think it was really just the first time, like as a first time mom, that there was denial. The second time and third time, I think it was different challenges, but it wasn't denial.
Yeah.
Yeah.
See, I still felt denial even with my second, because I was denying the fact that I became overly stimulated. I was like, how did I become this angry?
Yeah.
And that kind of brings me to stage 2 of anger. And so we have denial, and then we go into anger. And so with anger, we start feeling frustration and anger that we're losing our independence. We're losing our sense of self. This is where the struggle of like the identity shift happens, or we start falling into, that comparison with others or with our spouse. We're having a hard time adjusting with this new role because we're like resisting it, because we're still, we're still kind of trying to navigate, okay, but I can do it all. And how do I do it all? Like other people are doing it all, but like, to the mom guilt episode, how people are only showing the parts that look good, so we think, like, especially with social media, we think that they're doing it all, but we don't know what's happening behind the scenes. Some of the challenges that show up with anger, it's how do you balance being present as a mom and your personal needs? Because, that's when the kick in of the guilt happens at the same time.
Yeah, of course.
And so some of the ways that the anger really starts to show, it's when we feel like we're constantly being needed, or when our kids are pulling at us, or when we feel that sense of overwhelm, or when we feel unsupported because, maybe our need is to have time for ourselves and it's not being heard because like you might hide from your kids in the bathroom and you close the door and then they're in the bathroom with you.
Yeah.
You're like, I just needed this. Or like when you're trying to have this moment of like, again, same thing, hiding in the bathroom, and then they're outside of the door yelling and screaming. No, but they're crying. They want your attention. You're like, I just need 5 minutes. But they don't understand what 5 minutes mean. And what they need is, I just need you. I need connection. And I need to feel safe with you. And then that's when, again, the guilt happens of, I shouldn't be feeling angry. These are my kids.
Yeah, exactly.
So you're nodding, so you recognize, like, you
course.
recognize yourself in it too.
I think the anger part, all of us can relate. Like it's present quite often, I would say.
And I know we're gonna probably touch on this on a different episode when we talk about mom rage, but mom rage is not the same thing as anger. Even though they're both like emotions, anger is an emotional reaction, whereas rage is kind of beyond our control of when we feel it, where we're going to touch on it another time. And so we go through denial, we go through anger, and then we go through bargaining. So with bargaining, we're trying to almost like negotiate with ourselves of trying to find a middle ground, or we're trying to maybe even negotiate with our partner, or we're trying to, like, we're struggling with our sense of self of trying to see, if I just do this, I'm going to be able to be like myself. And I think part of like a big change that happens with a lot of women, or like when they become moms, is physically our bodies really change.
Yeah.
And sometimes we think, oh, if I just go on this diet, I'm going to look like my old self. But we also don't realize that our bodies physically, like our bone structure, also changes. You know,
Yeah.
it's not even just the weight, it's just your jeans might still not fit because your pelvic, like everything kind of shifts or changes, you know? And so it's like, oh, if only I do this, or if my kids start sleeping through the night, I'm going to be able to do this. If my child is going to start eating, I'm going to be able to go out because I don't have to feed them, or they're like, you know, whatever it is. And so you find yourself trying to connect with your past self.
Yeah.
But you still struggle with it
interesting.
because it's not that obvious, you know, like it's still a hard step to get back to, because we change. That's the part where we're not at accepting the fact that we've changed yet. We're still bargaining with each other. Have you found yourself in the if I do this?
Yeah, I mean, I think a lot of people deal with this as well. Like we're always trying to, I wouldn't say challenge, but like trying to think of the next thing that's gonna kind of push us to work harder or something like that. I think because I have many kids and I've gone through this many times, it changed over time. Like I learned to deal with these emotions and these feelings. What works for me is really focusing on being present and gratitude. I think I've mentioned this on every episode, but the daily gratitude, honestly, it goes a long way because it allows you to be present. It's very hard to actually just be present, think about today, not think about the future, what I need to do, what do I need to achieve, what do I need to, what do I need to do for my child today? Like just be present and let things flow. Yes, okay, still have your, your to-do list, all that. I'm not saying, just sit down and do nothing. Be present. Just think about the now, think about today. You can have plans for the future, but for now, just focus on today. That's it. And the gratitude helps you because it grounds you. It helps you just focus on now. What are you grateful for right now? I think it's something I learned from the mindset mentor. He always talks about this all the time. And over the years, I've like really gotten into a habit of doing it. I mean, as Muslims, we're supposed to be doing it every day anyway, because we pray 5 times a day. But a lot of us don't actually use this time to reflect or to practice gratitude. We're just doing the action of praying. And it's still good. It's still doing what you what you're supposed to do as a Muslim, but you're not getting the benefit out of it if you're not actually present and reflecting and practicing the gratitude. So.
That's a good point, because it brings back to how sometimes we're just on autopilot. And we're not necessarily taking the time to slow down and actually reflect. And then, when we go back, like when you look at bargaining, we were like, when things calm down with the kids, I'll be able to. But it's never going to calm down. Like every time they grow older, you're going to be in a new stage. You're learning new things because, I mean, look at us now. You're 3 kids in, and I'm 2 kids in, and we just realized that there's a word called mattresses. Like it's ever evolving, and we're still going to keep learning. So it's how do we, like you said, like how do we ground ourselves so that we take the time to slow down and really ask ourselves what's going on inside. Acknowledge it, make room for it, and then what do I do next? Because the next thing after bargaining is actually depression. And depression doesn't mean, being in bed clinically all day depressed, or clinically depressed, because oftentimes there's this idea that depression has to look a certain way. But when you start to lose focus, when you're having a hard time paying attention, when you're forgetting things, when you feel this sense of overwhelm, when you feel kind of isolated or things are not fulfilling you. And that's where that guilt also happens, because the attachment to motherhood is they're supposed to bring you a sense of fulfillment, and you're supposed to be happy, you have these kids, but that's where that mourning kind of happens, where you're also mourning your past self, And you might also be still struggling with accepting the new you. And so you're kind of looking at, what was I before being a parent, and how is my life just about my kids now? And why am I always talking about them? How do I make room for myself? So then again, it brings that sense of overwhelm of there's just too many things I need to touch on or think about. But then it feels overwhelming even more when we're actually not taking the time to pause and look at what is actually overwhelming us and who can I talk to about it?
Yeah.
Who do I trust? Do I have a support system around me? And these are conversations that you don't really hear a lot, at least within our cultures. Like talking about therapy or depression or mental health is something more common in the West than they are in other cultures.
Yeah.
And so it becomes harder to talk about these subject matters because nobody makes room for them. And now when we're making room for them, we still have to do that cross-cultural reference because it will still look different from one culture to another. And so sometimes we might find ourselves judging another person, like another mom, but we have to also look at, we don't know their whole story.
Yeah.
So all we can do, and that's again the intent of our discussions, is how do we hold space for that, where we can just have these conversations and create a space where we can just share, and we don't need to go into advice giving, sometimes we just need to listen.
Share,
And actually, statistics that we have with regards to depression is that even with postpartum depression, it actually affects 15 to 20% of new moms, where they really feel these emotional changes when they become new moms. And 15 to 20% is still a lot.
Huge. Yeah. This is not like this is like an overwhelming amount of emotional shift, I would say, that's like unbearable. It's not just because we all go through the emotional changes, we all go through they say the baby blues and all that, we all go through that, but postpartum depression is like on another level. Like we can't even understand it unless it happens to us.
Exactly. And I think it carries a heavier load of shame that, for example, baby blues don't. And I think that's something that we can address at a later point with maybe more of a specialist in the domain or something like that. So after depression, we go into acceptance. So acceptance is actually just coming to terms that this is part of our new identity. Becoming a mom doesn't mean that we lose entirely our whole sense of self of who we were before, but we are just kind of accepting that we're transforming into something else.
Yeah.
And it's part of it is embracing or finding joy in this new role, but not diminishing that that this now means it's challenge free or anything like that. It's shifting our perspective where we're like, okay, this is part of my new reality. How can I go on this ride without feeling like it's dreadful or anything like that? When we're not stuck just in the past, we're looking forwards to what's coming ahead, but we're still finding times to connect with who we were before. It's just, it might look different.
Yeah.
And so we might end up having this new sense of purpose, or looking how we're growing internally, like our personal growth is different as a mom. So making room for that. But it is based on research too, it's a big step in acceptance is a big step in being able to accept motherhood into our lives. And when we look at the 5 stages as a whole, they don't necessarily happen in order at all times.
Interesting.
You might go into, denial first, and then you might have a false sense of acceptance, but you're actually still in denial.
Okay.
But you're pretending that you're accepting it, but you're still in denial. And then you might go into anger and shift with bargaining, but then maybe the bargaining is still not necessarily shifting in the way that you want it to. So then you find yourself back in anger. And so when we talk about grief, there are 5 stages, but the amount of time you're going to spend in each it's not calculated. It really depends from one person to another.
Exactly.
It might take you more than a year. Like of being on mat leave, or like right now here, we're lucky we have a year-long maternity leave, but it could look different from one person to another. I had a friend ask me, like, how are you finding the time now to work on this podcast that you started and working full time and being a mom? And I told that person, I'm like, because things shifted with me. Like, my experience with my second was very different from my first. I wouldn't have done this in my first because I was so like by the book with they need to be they need to be asleep by this time, and I need to do this trend, and now apparently we need to parent this way, and so it was shifting. Whereas with my second, my challenges are different. I still have challenges, but they're different. But I let go of certain things,
More
like
confident too.
Exactly. I feel more confident in it, and now when I question myself on things, it's not from am I doing the right thing? It's more of, okay, is this the right thing for me?
Exactly.
But I'm like, now it's been 2 years that I'm a mom of two. I didn't have this self-reflection a year ago when I first became a mom of two. So that's the part where it's like a gradual change, and it goes back to, we can't compare ourselves to other moms' experience because we don't know what their lived experience is that brought them to be the type of moms that there are now, or how they're parenting. We don't know what their circumstances are. We don't know what their community is, like who's their support system. We don't know what their relationship are like with their partners. Right. Like, there's so many factors. And people are only going to show the part that they want to show.
Of course.
And so we need to keep that in mind as we're going through these 5 stages, because we're going to often find ourselves comparing to somebody else, which I think is part of a human thing to do, like, because you want to feel good, you want to feel validated, but we need to make sure you don't spiral into feeling stuck in one. And if you do feel stuck in one, like, you might feel stuck in either the bargaining or the anger or the depression. Like, we're hoping that, if you listen to us today, the intent is that you feel like you can reach out to somebody, that you don't need to be stuck, that there is support. And if you don't have somebody in your surroundings, like whoever's listening to us, then reach out to us. And then that's the intent of having a support system or a sense of community, because we all need that sense of belonging. But motherhood can really make you feel too ashamed to ask for support.
Of course.
So that's what I have for you on that.
That was very interesting. Thank you for sharing. So this was part 1 of how motherhood transforms us. Stay tuned for part 2 next week, where we'll be discussing how to rediscover ourselves, rebuild, and our rebirth. Follow us, send us a DM of what you thought about this episode, if this resonates with you, how motherhood has transformed you. Send us a DM or comment on the videos. Thank you.
Thank you for watching.